Hello and a very warm welcome once again. I am Mugdha Kalra and I present to you the third episode of our ongoing podcast series Rainbows of Hope, brought to you by Rainbow Children's Hospital, India's largest group of hospitals for pediatrics in association with Earshot. In this unique series, we are bringing to you the wonderful world of children and their angels from God, their doctors. Lives of parents and near and dear ones revolve around their children. And this world comes to a standstill when something happens to their health. And in those times, one needs to be strong, take quick actions, and always stay hopeful. This is precisely what this series is all about, hope. Hope that also the doctors bring to us. In the first two episodes, we discussed autism and blood disorders in children. In this episode, we will be talking about congenital heart diseases with Dr. Chinnaswamy Reddy, Chief Pediatric Cardio-Thoracic Surgeon at the Rainbow Children's Heart Institute, Banjara Hills, Hyderabad, where the motto is, "The tiniest hearts deserve the greatest care." Dr. Reddy is one of the popular cardiothoracic surgeons in the country who has served as a faculty in some of the renowned institutes of cardiology. With decades of experience, Dr. Chinnaswamy Reddy specialized in the most advanced pediatric cardiac surgery and is an expert in handling congenital heart diseases. Welcome, Dr. Reddy.
Thank you, ma'am. Thanks for the invitation.
So, doctor, there are congenital heart conditions. Are there also acquired heart diseases?
So the congenital heart diseases are actually nothing but birth defects. They are babies born with the defects in the heart are called congenital heart diseases. So there can be, we call it as acyanotic congenital heart disease, where the baby is not blue, and the other category is called cyanotic congenital heart diseases, where the babies are blue. So they, because of the mixing of impure blood with the pure blood. So there are actually, so though the heart is a single organ as such, there are actually multiple problems. Multiple baby can be born with multiple, defects in the hearts. So actually speaking, in our country, if you take an average, nearly 2 lakh kids are born with the congenital heart disease in our country, taking approximately 9 to 10, babies per 1,000 live births have congenital heart diseases. So the burden of the congenital heart diseases in our country is actually quite big. So the infrastructure what is available presently is in fact is not sufficient enough to cater the needs for all these kids.
Doctor, what are the symptoms of these conditions?
Usually, babies with congenital heart disease can present as early as day one after birth. So many of these kids who present early in the life usually are cyanotic congenital heart diseases. And even, of course, there are some acyanotic also can be presented in what is called neonatal period, that is within 1 month of life. In fact, 30 to 40% of congenital heart disease actually may require some kind of intervention during this early, neonatal period. So these are the most common being the transposition of the gate arteries, where the arteries are actually not normally arising from where they are supposed to arise. For example, the pulmonary artery, which is supposed to arise from the right ventricle, arises from the left ventricle, whereas the aorta, which is arise from the left ventricle, arises from the right ventricle. So the circulations where gets transposed. So instead of the right ventricle pumping impure blood to the lungs, it actually pumps the impure blood to the body. On the contrary, the left ventricle, instead of pumping the pure blood to the body, it will be pumping pure blood back to the lungs.
Right.
So they become actually circulations of parallel circulations instead of normal circulation, which is circulation in series. So one of the example, as I told you, transposition of gate arteries, there are many things like total anomalous pulmonary venous drainage, pulmonary. There are right heart obstructive lesions. There are left heart obstructive lesions. These all can present to you in the first month of life. So later during infancy, what we call from 1 month to 1 year of age, we call it as that's infancy. So in the early infancy, some of these like ventricular septal defects, which are acyanotic diseases. Then there is what it is called tetralogy of Fallot. It's of course, though as a cyanotic disease, can present late. So there are other conditions like pulmonary, truncus arteriosus.
Right.
So on. There are actually many other. Then atrial septal defects. So things are, there are many actually present with congenital heart diseases.
You are listening to Rainbows of Hope, a unique series on childcare by Rainbow Children's Hospital in association with Earshot. Dr. Reddy, what are the most common heart conditions that children manifest, and are these curable?
See, typically, we classify usually them as I mentioned earlier, those with acyanotic congenital heart diseases, where there is no mixing of improved blood with the pure blood. For example, atrial septal defects, ventricular septal defects, we call it as increased pulmonary blood flow situations. Usually, these kids present to you, or maybe in the the first month of life, later part of the first month of life, or early infancy with breathing difficulties. Then they tend to have sweating, like forehead sweating, or was while feeding. Then what we call as interrupted feeding, we call it as suck rest suck cycle. That means they feed, they take the milk for a while, then take rest, then again start taking. That we call it a suck rest cycle. So then this is how actually they present, and sometimes frequent respiratory infections, cough, cold, and sometimes fever as well, that last longer. So we call it as recurrent respiratory infections. And most importantly, what we call as failure to thrive. That means baby is not actually gaining weight as supposed to gain as with any other normal kid. So these are all the usual symptoms they present with in acyanotic congenital diseases. Whereas in cyanotic congenital diseases, usually they present with increasing bluish discoloration. For example, lips, tongue, hands. You can see the bluish discoloration, and which is progressively increasing, associated with the breathing difficulties. This is one of the way they can present, the cyanotic disease will present with.
Dr. Reddy, what are the interventions available and what is the duration of these treatments usually?
So here again, as mentioned earlier, some of them require as early as first month of life. Require even as early as day 1, day 2 of life may have to undergo either cardiological interventions or cardiac surgery. So as I mentioned earlier, transposition of the great arteries is one of the conditions which requires operation in the very first month of life. So likewise, you have right side obstructive lesions, wherein the blood flow to the lungs depends upon, actually there is a duct artery connection between the pure blood vessel and impure blood vessel, what we call as ductus. When it starts closing down, they start manifesting with increasing cyanosis, breathing difficulty. Even they might actually have, they can come with a gasping like situation. So these babies can be salvaged by what is called placing a stent within the duct. We call it as PDA stenting, in order to maintain the blood flow to the pulmonary circulation, and vice versa is also true when there is left side obstructive lesions as well. So that is a life-saving procedure. And on the contrary, in place of stenting, we can as well do what is called a Blalock-Taussig shunt. That means placing a shunt between the pure blood vessel and the impure blood vessel, what we call as Blalock-Taussig shunt, in order to improve the pulmonary circulation, so that the baby will get, oxygen gets improved, will be saturated well, and the overall clinical status improve, and plan the subsequent operation at an optimal time.
You are listening to Rainbows of Hope, a unique series on childcare by Rainbow Children's Hospital in association with Earshot. Dr. Reddy, what generally is the prognosis in such cases? Do children completely recover? Do they need multiple surgery as they grow up?
So overall prognosis, of course, depends on the problem to problem. In other
Correct.
words, the congenital heart disease, what type of congenital heart disease is. So overall, majority of the patients live up to adulthood and rather late adulthood, and some of them actually potential or curable. For example, the defects like atrial septal defects, patent ductus arteriosus, coarctation of the aorta repairs, or ventricular septal defects, and they are virtually curable. They are cured for life. For example, total mass pulmonary venous connection, they can be cured for life. They can live as normal as any other any other normal human being.
How
Of course,
wonderful.
there are other diseases which require staged procedures, sometimes multiple operations over the period of time. So in those situations, the lifespan may not be equal to that of the normal population. But however, in the present day, there is no doubt that if timely intervene, they can live up to late adulthood as well. So coming back to the timing of the procedure, Of course, some of them, not that every baby born with heart defect requires immediate intervention. Certainly no. Based on the type of the disease, we decide whether it needs to be done now, can be postponed. For example, to give an example, an atrial septal defect, that's in a communication between the right side of the heart called right atrium and the left side of the left atrium. There is a septum wall between the two. When there is a defect in that wall, we call it as atrial septal defect. So in such situations, actually, we don't need to do the procedure till 3 to 5 years of age. We can safely postpone to 3 to 5 years of age. So, for example, a baby with ventricular septal defect may not require very first month of life, but usually they require around the 3 to 4 months of life. And likewise, babies with tetralogy fellow born with the what we call blue baby syndrome, some of them may not require, in the early in life, can be postponed to 6 months or beyond that. So based on the symptomatic status and the type of the disease, we do take the decision accordingly.
How often are these heart conditions misdiagnosed or perhaps missed completely?
As far as the heart defects are concerned, it does happen many times. We do have seen babies presenting late. They are presenting so late that they already reach a stage of inoperability. That means they cannot be operated anymore. That's why for any disease in the heart, there is actually timing. So if you miss that timing and goes beyond that and beyond, and then they can become inoperable. We call it as inoperable because, for example, there is a defect in the heart, what we call as ventricular septal defect between the left ventricle and the right ventricle. The septum, there's a big defect there. These usually require intervention by about 3, 4, 5 months of age, need to be closed. Suppose they are not detected, or for some reason they're not actually diagnosed, because many of our population are rural population. So sometimes they might miss the diagnosis, or sometimes even the babies themselves also tell us, sir, doctor has told, maybe it will close down over a period of time. Let us wait and see. In fact, waiting for that for quite some time. Actually, when they have landed with us, they are already inoperable. They cannot be operated because they develop such severe pulmonary arterial hypertension, the damage to the lungs, it has reached a stage of irreversibility. So such babies, we cannot do the closure of the defect in the heart. In fact, in such babies, we have to do lung transplantation because lungs are already damaged completely. Though the defect is in the heart, that actually the effects are on the lungs. Lungs bear the effect, actually all these effects. So, so in such situations, we have to do lung transplantation and close the defect in the heart. But as you know, lung transplantation, of course, not only that, it's availability of lung and complexity.
Very
and even the long-term survivors are not really great. So not that they live for life with the transplantation.
Doctor, congenital heart conditions we spoke about, are there also acquired heart diseases?
Yeah, that's actually what we call these defects. When they're born with the defects are called congenital. Sometimes kids do acquire some, what we call as acquired heart diseases, which is what is commonly seen in pediatric age group is rheumatic heart disease. Rheumatic heart disease is a condition where, especially seen in low socioeconomic status and overcrowded, environment, where they develop what is called rheumatic fever. This starts with throat pain, then joint pains and swelling for a wrist, elbow, knee, ankle, and all the joint pain as well as swelling. They'll be actually fleeting in nature. It sometimes appear in right wrist, then again appears in left wrist, again right knee. Sometimes like that they keep on changing. That we call it as a fleeting nature. So the rheumatic fever, when has to be identified and promptly treated. Otherwise, it can affect the heart. That's why it's called rheumatic heart disease. The rheumatic fever begin with may not have affect the heart, but if not diagnosed the rheumatic fever and treated promptly, it can affect the heart. And when the heart gets affected, mainly the valves in the heart gets damaged. We have 4 valves in the heart, 2 on the right side. We call it as tricuspid valve and the pulmonary valve. 2 on the left side, mitral valve and the aortic valve. But more often the left side valves get affected, mitral valve and the aortic valve, they get damaged. Either the orifice the valve opening can become very narrow, or either they can become leaky. So both are dangerous to the life. So because these valves The function of this valve is to open, close, open, close. With every beat, the open, close, open, close. Suppose
Right.
if our heart rate is about 70, 80, it opens 70, 80 times per minute, it opens and closes. So that is that is the importance of the valve. So the valve allows only one way flow of blood. It doesn't allow back coming back to the. It has to keep on and on, keep going.
Dr. Reddy, India has been progressing when it comes to medical interventions. At Rainbow, you also have patients coming in from across the subcontinent. What does it take to build a super specialty cardiac unit?
It takes a lot because see, to begin with, actually to begin with cardiac surgery in India, it all started with begin with adults, young adults, adolescents, and later age. Begin with the later age. So kept on lowering the age to 10 years, 5 years, 1 year. Now in infancy, now we have come to neonatal. So now we are in a position to do open heart surgery for a neonate as early as day one. So we are able to cater the treatment. So no doubt, there is in our country, the cardiac surgery, though the cardiac surgery is actually relatively a new specialty. It has grown by leaps and bounds, and I am happy to say that we are no less than any other country in the world as far as medical advancement of medical treatment is concerned. So we have come to a stage now that we are able to operate on neonates, just born babies, open heart surgeries, and would give the as good results as with any other advanced Western country. So this actually is a teamwork. It's actually a teamwork. It's not actually an individual team of cardiologists, cardiac surgeons, anesthesiologists involved, and then intensivists involved. And of course, this as far as the manpower is concerned. And no doubt we need the infrastructure as well. Without the infrastructure, we can't perform the best of the procedures. So the infrastructure also proportionately has grown. Our setups are no less than any other international setups, as with developed countries. So that has made both the progression, the knowledge, skill, and as well as the progression, development infrastructure has actually made the difference.
Well, that's it for now in this episode of Rainbows of Hope. Thank you, Dr. Reddy, for taking out precious time for us. Parents and near and dear ones of young hearts listening to our podcast, we have Rainbow 1 for complex and critical cases. You can contact the Rainbow Children's Heart Institute at 8882 046 046. I'll repeat, 8882 046 046, or email at info.rchi@rainbowhospitals.in. You can also visit the website www.rainbowchildrensheartinstitute.in. Until next time, stay happy, stay healthy, stay safe. Bye-bye.